are the recent paradigm changes we have seen in the management of heart failure in probably last 2 to 3 decades?
So there have been several changes in the last 2 or 3 decades, but let's talk about what has happened over the last 3 or 4 years. So certain new drugs have come, and basically there have been 4 major changes. One is a drug called ivabradine, which has become available, and this is a pure sinus node suppressant which reduces heart failure and has been shown to reduce mortality in heart failure patients over and above about the standard of care by about 18%.
There is a sudden change in lifestyle of our country. Originally, we were all hard-working people. We are all agricultural people. So we are living on a land where we worked hard and ate the same food, same water. So our body was made up of the same soil, same water. Now today what happens? You eat Punjab wheat, Kashmir mirchi and Andhra rice, like that. Our body has become embodiment of India. But this sort of food from different directions also is not doing well for us.
Chronic heart failure may be of 2 types, one with reduced ejection fraction, another is with preserved ejection fraction. Now the ESC this year has brought another classification, that is mid-range heart failure, mid-range ejection fraction. So that also towards the reduced ejection fraction group, the line of management is same and similar as case of reduced ejection rate, this mid-range.
What is the purpose of doing this thing? That needs to be explained.
Yes, sir.
Till date, we always followed the Western guidelines.
Yes, sir.
And there are a lot of differences in the ground reality, what is happening here in India and in the West.
US or Europe, true.
Our STEMI burden is more. 60% of our ACS patients have STEMI, while this is less than 40% in the Western literature. Majority of the patients, they live in the rural areas where they practically do not get any form of reperfusion, leave aside primary PCI.
I had a very interesting topic to present is it the end of the statin, the king statin? With the advent of newer agents like PCSK9, do you feel that role of statin in the current management of cardiovascular disorders will take a step back?
No, I would say actually the statins are here forever. Nothing can replace the statins. Statins are the class of drugs that have been responsible in a large part for the more than 50% reduction we have seen in cardiovascular deaths.
Today only we had a healthy discussion with a group of people about this modality of treatment, which is comparatively new. In 2002, Dr. Alan Kribbier performed first transcatheter aortic valve replacement, and this was done on a patient whose life expectancy was only 1 day. So you can imagine with what courage in such a sick patient who was likely to survive only for 1 day, Dr. Alan Kribbier performed this procedure and totally new for the first time.
Well, the most important thing is the evaluation of pulmonary arterial hypertension is done by 2 ways. One is invasive and second is non-invasive. Invasive method is by looking at right heart catheterization, and non-invasive method is by echocardiography. A good echocardiogram done by an expert echocardiologist is as good as right heart catheterization for doing a.
How you feel about the CSI conference and how all the activities are being conducted in the CSI Kochi, sir?
Thank you. Pleasant morning and hearty welcome to all of you who is watching CSI TV. Well, CSI 2016 Kochi is a conference with a difference in many ways. We have about 5,000 delegates coming up for this conference. We have also.
So, sir, what do you feel? How is the incidence of cardiovascular diseases in India as well as globally?
So, India we don't have exact data, but from the US data, what we have is there are 4 lakh deaths per year in US dying of coronary disease.
General population regarding the STEMI onset, because we find the patients with acute MI much later than in Western countries. So it's a burning issue, and
we take a cutoff of 15%. We don't do anything.
Okay.
The likelihood that he has coronary disease is very low, so we do lifestyle modification. If the likelihood is very
sir, I would like to know how is your opinion regarding the blood pressure measurement office versus home measurement?
Hypertension is a very high risk factor for morbidity and mortality. And nowadays we are seeing that younger people are coming with very high blood pressures at a younger age, and they are also very difficult to control.
Even in the eastern part of India, we do come across cases every night, every day, at least I would say 5 to 6, sometimes even.
Clinical diagnosis. It is diagnosed mainly on the symptoms and signs of the patients. But when you suspect it, you have to do some diagnostic tests to confirm your diagnosis.
How is the incidence of IHD and diabetes in India?
India has the dubious distinction of being home to the highest number of diabetics and ischemic heart disease patients together. In fact, the incidence as of now is around 50 million ischemic heart disease and around 60 million of diabetic population.
So I'd like to know about chronic total occlusion more in detail so that other colleagues are also helped with this. So how common is CTO in overall practice in today's world?
Yeah, you see chronic total occlusions are seen in at least about 15 to 20% of the angiograms that we do. So 20% of the angiograms will have at least one artery that is chronically occluded.
In hypertension, in India it is still awaiting its approval. Hopefully the approval will be through in a couple of months. Already it is approved in the West, United States, Europe, etc. Now, what is so special about Asilsartan in comparison with the other ARBs?
So, sir, can I ask you how commonly you see this kind of patients in your practice in country?
I mean, it's not uncommon. The problem here is that most often we miss because the patient presentations are very, very vague or undiagnosed.
Which agent you are using. Generally, the incidence is between 0.5% to 2% of patients who receive thrombolysis. It also depends on which type of center you are looking at the status.
Which we see in the cath lab after angiograms have diabetes. This is a very well known fact in any major high volume cardiac center. So it's a very common association.
Right, sir.
And diabetes has always been a challenge.
Because about your topic on the SPRINT trial, so may I ask, sir, what was the need for conducting such a clinical trial?
Now that hypertension is very much prevalent among the adult population, up to 20 to 30% of patients at the age of 60 years, they are suffering from hypertension, which has got morbidity as well as the increased mortality in the terms of cardiovascular events, increased cerebrovascular event, peripheral artery disease and cardiac failure in future. So people were trying to look to what should be our target of blood pressure control, thereby prevent this end organ damage or mortality reduction.
Related symptoms were excluded in the trials, and therefore the incidence prevalence was a bit less. But in clinical practice, of course, it is 10 to 15%.
Typically, what kind of signs and symptoms patients are presenting to you?
Majority of the patients, they present with muscle-related symptoms, muscle ache, stiffness, tingling, and all those.
This is intravascular ultrasound, and so you can get an idea about the size of the vessel, you get an idea about the length of the lesion, you get an idea about the calcification of the lesion. So lots of things you are able to gather before you do the bifurcation, and after the bifurcation stenting you can once again see the result on the IVS, whether it is adequate or not, the stent struts are posed properly or not, all this info.
If you go through the literature, we don't have very hard data from our own country, but if you go through the literature, anemia is a very common problem. In prevalence studies, it has ranged from.
So, sir, can I ask you how commonly do you see this kind of patients in your clinical practice in the country?
See, on an average, you may find about 5 to 6 cases every month.
Okay.
6 cases every month. It's not an uncommon clinical problem, but unless you keep it in your mind.
So with me today is Professor Dr. G.S. Senani, sir. Sir is one of the senior most practicing cardiologists of the country and also was awarded Padam Shri by President, the honorary award. Sir is currently associated with Saifi Hospital and Jaslok Hospital in Mumbai. Sir, it's almost more than 5 decades of cardiology practice. So how has the non-communicable disease burden or the epidemiologically changed?
Everyone is aware of diseases like atrial fibrillation and heart failure alone.
Yes, sir.
But when each disease is affecting our morbidity, its incidence may be less when they are alone. But if they are together or having a tango effect, we call it.
Even the LDL level and the cardiovascular event. In Emcure trial, the data shows when the LDL is less than 50 as against LDL less than 70, there is a significant difference in the cardiovascular event. Almost 2% absolute risk reduction when the LDL is less than 50. It has been also noted when we use statin in moderate to high intense dose,
I have always believed in your talks and all, and you have always said that prevention is better than the cure. Is it true for cardiovascular disorders as well, sir?
Yes, very much true. You see, as you said, I have watched cardiology being developed from almost ECG machines to the interventions. But what has pained me is that heart disease has not decreased. Awareness has.
Patient prosthetic mismatch in patients with aortic valve replacement means that for a patient with a large body surface area, a relatively small sized aortic prosthetic
adds a little twist to the whole scenario, makes it more interesting. We call it Star Wars because really the stars of cardiology from all over India are participating. Of renowned academic institutions are heading the teams.
I am glad to have with me Dr. K.K. Sethi, sir. Welcome, sir, to the studio. Sir is the past president of Cardiology Society of India and is the chairman for Delhi Heart and Lung Institute, New Delhi. So I welcome you, sir, for this talk on this live TV. So to begin with, may I ask you, sir, how is the incidence of stroke and embolism worldwide and atrial fibrillation, how it differs from Asian to non-Asian?
So we'd like to know how had been your experience with this kind of a usage of tenecteplase in your patients, sir?
Well, I think we have quite a vast experience with tenecteplase. If I remember correctly, I think we were one of the participating centers when this got introduced in India. And then we had initially it's about 100 patients on tenecteplase with a...
has done a lot of pioneering work in STEMI and also part of the team who has rolled out the hub and spoke model, I believe, in the country. Sir, is this model replicable across the country? How do you see it going forward, sir?
Well, just to tell you, the model was validated in
Another 10 crores are in the pre-hypertension. But unfortunately, the home blood pressure monitoring is not popular in India. Home blood sugar monitoring is at least to a certain extent popular. In those days when we had home...
Ma'am, your practice has been rolling more about pediatric cardiology and recently we have seen a lot of childhood obesity is on increase.
Correct.
So what is your take? Why are we seeing this problem beginning from such an early age, ma'am?
Yeah, Rishi, you know what has happened is there's a paradigm shift between how our childhood was and today's childhood.
No hypersensitivity, as I mentioned to you, no hypotension. You're not to given the infusion form, no bottle required, no IV set required, nothing is required.
Across the globe, I think this is the agent which is used.
Used extensively. I only one request, people always talk of cost. I don't think anything is more expensive than life.
True, very true.
Still.
You know, angina is the chest pain caused by ischemia to the heart or myocardium. And though we don't have accurate data from the Indian subcontinent, but the prevalence has been rising from around 4%, I believe.
To begin with, I would like to understand from you the role of intravascular imaging in PCA and what are the benefits.
I think there's a lot to say about intravascular imaging in PCI. I think we can start off by saying that it's probably underutilized in coronary intervention.
Overall heart disease burden itself is increasing, although the rheumatic heart disease incidence is going down because of improved hygiene and improved patient education.
Prevalence of hypertension is quite high in India and this continent, Southeast Asia. In comparison to the Western countries, I think the incidence is even more than the Western countries. And at present, what I can say, the incidence of hypertension is gradually rising day by day.
Once you diagnose a patient likely to be suffering from mitral regurgitation clinically, the first investigation to be done is of course a simple 2D transthoracic echocardiography, because that will give you, that will confirm the diagnosis of mitral regurgitation, tell us about its etiology, tell us about the morphology of the mitral valve apparatus and the severity of the mitral regurgitation.
The absolute prevalence of atrial fibrillation in Asians is less than what we have seen in the Western countries, because primarily atrial fibrillation, and when we talk about atrial fibrillation in this particular context today, we are talking about non-valvular atrial fibrillation, which is not related to valvular heart disease.